Hey, this is Russ. You know, I'm just curious. How many of you actually went on YouTube and took a look at knee replacement videos? Or let me ask you this. Did you at least Google knee replacement and then took a look at Google Images and took a look at the photos? I'm just curious how many of us actually did that. All right. I know that some people are squeamish. They don't want to see it. All right. And some people don't care, so they watch it. So where do you stand on this? Did you do it? or okay, let's do this. After your knee replacement, did you do it? All right, let me tell you a little bit about me. All right, some of you know that I had worked in law enforcement in the past. I've been to autopsies. I've been to homicides. I've been to a lot of things. All right, so seeing something like that firsthand doesn't really bother me so much anymore. I've seen enough of it. I've seen full autopsies. All right, so for me to see it, it probably wouldn't be a big deal, right? I don't want to see it on myself, though. All right. Okay, let me back this up. If the doctor took photos of it and showed me the photos of my own knee, I would want them, and I would want to see them. Okay. Being awake during the actual procedure and seeing him do it on me, that I would not be able to do. I don't think I could handle that. Right? Okay, so to answer the question for myself, did I do those things? Did I look at those things? Yes, I did. I watched knee replacement videos before my knee replacement surgery and after, okay? And I looked at photos as well, okay? So this didn't bother me so much. I just wanted to know what was involved, and I knew kind of what was going to happen because, like I said, I've seen autopsies, all right? But let me tell you something. It's a lot tougher knowing that that's going to happen to you, right? So for me, I have a problem knowing it's going to happen to me. But if I was watching somebody else's, no, I wouldn't have a problem with it. I could probably even be in the operating room with somebody's knee replacement and do the photos or videos of it. It wouldn't bother me so much. Okay. But for myself, yeah, it would bother me. All right. Okay. Let me tell you one more thing. Even when they put in the what do they call it? The IV. Couldn't get it out of my mind here. The IV. I can't even watch them put the IV in me. Yeah. If they're doing a blood draw on me, I don't usually watch them poke me. I don't. I know it's coming. Okay. I can feel it. I just don't like watching it being done on myself. If they were doing it on you, I could watch that. Right? It's a little strange, but that's the way it is. I can watch somebody else's, but I can't do it on my own. I can't watch it on my own. All right. Now, if the doctor gave me those videos or photos, if they actually did that in the operating room, I would want them and I would watch them. Yeah. But as it's happening, no, I don't think I can do it. Okay. Let me show you the knee that I actually got. I have a Zimmer Biomet Persona knee. Now, I don't know the difference between these things, but I do remember asking him that I had read that this particular device had people suing people over it. Okay, you know what the doctor told me? They all do. It's probably true. He says they all have somebody suing over something. And there's always someone that's going to complain that it wasn't as good. And the reason he told me he uses this particular device is because he's done it on a lot of people and he's had very good success with it. That's why he uses it. So based on the fact that you have to trust your doctor, I said, okay, that's fine. We'll use that. Okay. And I don't want him putting in something that he's not familiar putting in. I want him to put in the stuff that he's used to doing, right? So that's what I have. But anyways, it's just something that came across in my mind. I was thinking, how many of us really look at this, and do that kind of research? Put a comment below. If you did some research to that extent where you were watching videos, looking at the photos, searched a little bit about the type of knee that was going into you. If you did any of those things, put a comment below. Let me know, all right? I'm just curious how many people do it. Because I know that some people don't. Some people just, oh, I'm going in for a knee replacement, and then next thing you know, I've got the knee replacement. And they have no clue what's in there or how it's even done, okay? Let me know how you did it, all right? Here's another thing I wanted to talk about too, okay? Besides watching videos and besides doing photos, how many people did you talk to before you had your knee replacement done? Now, I know that some people go on these forums and these groups, Facebook groups and the like, before they have their knee replacement, and they ask a bunch of questions. I think that's actually pretty smart, but part of it could scare you. I mean, even this video could scare you, right? So I'm just curious, how many people actually did that? All right, did you actually get in contact with other people who had it and asked a bunch of questions? All right, so for me, I don't think I was prepared enough. I knew that I was going to go in for a knee replacement one day, but it was kind of done based on convenience, all right, because I kind of felt that this was the time to do it. I wasn't quite the type of person that had so much pain that they had to do it. So I was a little bit different, and I think because of that, I wasn't really prepared the way I think you should be prepared. But again, you might not want to be prepared. You might want to kind of, the less you know, the better off. You know what I'm saying? Some people are like that. Let me know. Okay, put a comment below. Anyways, if you like this video, hit that like button, hit the subscribe button, hit all those things. I'll talk to you guys next time.